be doing dumb stuff, y'all. Okay, go ahead to your occult blood. Colon cancer. Occult blood, right? So let's put a couple things down there. At the top, you need to put colon cancer, obviously. Colon cancer is very genetic, but it is also related to high-fat diet, red meat, obesity, colon cancer. Usually we see colorectal cancer written on a chart because they're together, right? They're nicely next door to each other. So whatever is going on in the colon might head on over to the rectum. This is the most preventable cancer death. And what is it in this country? Shit, number 3. And if you don't count male and female cancers, it's number 2. But it's the most preventable. Nobody had to die from this shit, but nobody's going to get their colonoscopies. So I guess somebody heard y'all's plea for help. And they came out, and you should have seen it by now, please write it down, with Cologuard. Y'all seen that on the commercials yet?
Yeah.
Only old people paid attention. Young people ain't watching shit. Y'all on Netflix and shit. Old people be like, for real? Got Cologuard? Okay, this is a stool DNA test. No prep needed. No prep needed. Wow. Now you don't have to write this down, but let me just assure you, your doctor orders it. It's like a prescription or order. They send that shit to your house. You pooping something, send that, and it gets picked up. You ain't got to send the shit nowhere. They pick it up. And I guess they go ahead to the little lab of their choice, wherever your doctor's registered. They give him the result. This is revolutionary. It has the same accuracy as a colonoscopy. Oh, yeah. And it's paid by for most insurances. OMG. This is revolutionary. Cologuard. Cologuard. Stool DNA test. Just as accurate as a colonoscopy in normal people, not in high-risk people, in normal folks. Almost everybody in here is probably pretty, normal risk. It is not for the patient who's had the number 1 risk factor, which is polyps already. If you've had polyps already, your ass don't qualify for no damn DNA test. If you've had polyps, we want to do a colonoscopy because I can go in there and take the polyps out while I'm in there. So polyps are the number 1 risk factor for colon cancer. Okay? So if you have polyps, you don't qualify for Cologuard. If you have a first-degree relative with colon cancer or you're positive BRCA gene, you don't qualify for Cologuard. Okay, so you're high risk, right? Come on, man. Okay? Lynch syndrome is part of a colon cancer that is genetic. Just remember to write that. Lynch syndrome, that's a genetic colon cancer, a very, very aggressive genetic colon cancer. Occult blood is on your handout. What does occult mean? Hidden. Occult, the word, means hidden. So you see the page, it says let it appear blue. Blue is positive. What's negative? Green. You better know that. So blue is positive, green is negative. You only need the patient to pinch an inch. Quit trying to give me a whole freaking toilet full of stool. I don't need all that. It's too much. Doing too much. Okay, so you just need the patient to pinch an inch and send it in. Okay? Now, melena is what again? Tarry stools, right? Blood in the stool, tarry stools. It is usually going to represent the right side cancer, the right side of the colon with cancer, melena. The left side of your colon will present with bright red blood. That might be down there already, I don't know. Let me see. Yeah. Is it? Oh, upper GI. Yeah. Well, put the sides, because I don't think they show you the side. Colonoscopies are done, and they're going to still be done, you know that. Colonoscopies need to be done at 50 years old, and how often? Every 10 years. 50 years old, every 10. That's the screening for colon cancer. 50 years old and every 10 years. Okay, unless something else is going on, then it's, you're high risk, you go and do something different. But this is for routine folk. They need a bowel prep. What do you know about this prep? Go lightly, laxatives, but what do you know about it?
It's awful.
Drink is awful. Drink until clear. Use that language. Drink until clear. Not drink until tan, not drink until yellow, not drink until brown, not drink until light brown. I said drink until clear. You are pooping water out your ass. Clear water. You got to be real clear about that or you're going to get a patient to get an infection. What color is your poop? I don't have any. It's just water. Good answer. Drink until clear. Okay, that's so important. Because when you don't do that, you put E. coli all over the bowel. That's called peritonitis. Okay. Sigmoidoscopy, as far as I'm concerned, a waste of your fucking time. However, there's still retarded people getting them, or not getting them, but doing them, because they shouldn't even be doing them. If you're going to go up my ass, make it worth my while, give me a whole colonoscopy. Why are you wasting my time? What does a sigmoidoscopy do? It looks at what? Sigmoid colon. You only looked at the left side of my damn colon. What's wrong with y'all? That's crazy, ain't y'all? Didn't I just tell you shit could be on the right side? Mm-hmm. Okay, so that's just ignorant. So don't waste my time, and I don't even talk to patients about it shit. Okay, so sigmoid. Why would somebody do that? Because they don't want to do the bowel prep. What do you have to do instead? An enema. Please. Okay? Okay, good. There it is. Now, the next page, I want to put a couple of things about prostate cancer. Remember that in many men, this does not need to be treated. In others, it's extremely aggressive. Right? In many men, this does not need to be treated. My dad has had this for years. He's doing great. But in others, it's very aggressive. What is the screening? Digital rectal exam. Don't be in here talking about PSA. Digital rectal exam is DRE. Digital rectal exam. And then based on that, the PSA. By the way, if the prostate has a cancer on it, it's going to feel like a rock hard feeling. There is no mistake in that digital exam. That's why, again, this did not need to kill one man in America, but they will not go for their physicals. There is not one man in America that needed to die from this, but they never go for physicals because the shit is so easy to figure out. It's rock hard. It's just like testicular cancer. It's rock hard. Normally it should feel like a tomato. It's rock hard. There's no mistake in this shit, okay? I need y'all to know that shit because you got a lot of men ain't going. And it doesn't make any sense that they die from this, okay? Now, so that's your prostate. Remember that we're going to do a biopsy and follow the Gleason score, Gleason. We're going to do a biopsy and follow the Gleason score. Gleason. So if it's cancer, we'll follow the Gleason. My dad's Gleason score has been the same for 20 years, so they never did anything. One last thing about this page is at the bottom on the sign. It says don't have intercourse or something, rectal exam or intercourse or ejaculate before a PSA. Now, PSAs are based on your age. We used to say this, 0 to 4 was normal. And that's basically still true, but look what it says in the bubble and highlight all of it. It says, the two bubbles, the PSA range for healthy prostates is 0 to 2.5. Then in the next bubble it says, with my what? Benign prostatic hyperplasia, right? They gave me a 4 to 10 range. So it's based on a lot. It's not a 0 to 4 test anymore. It's based on, do you already have BPH? Are you older? Then we'll give you a higher range. Their friend was how much? 20. Well, that's crazy as hell. Okay? Y'all gotta highlight that. It'll make more sense if you know that, those two bubbles. So we don't say 0 to 4 anymore. Because maybe 4 is not good if you're 30 and I feel a rock hard pebble, right? Maybe 4 is fine and dandy if you're 90. I'm sure it is. Okay, so it's based on age and what the exam is. Okay. Find the mastectomy page and go to the page right after. It should say alterations in body image. Put ovarian cancer on at the bottom, at the very bottom in the little space, and put deadly but rare. Ovarian cancer, deadly but rare, no screening. Right after mastectomy page. Deadly but rare. The only signs and symptoms is bloating and constipation. You are at risk if you're infertile or never been pregnant. Nulliparous. Okay? Deadly but rare. A little bit above it, put uterine and make sure you know the space above it. You got like blocks and you got spaces between the blocks, so put uterine and make sure you know it's also called endometrial cancer. That's what it is, endometrial. This is related to obesity. Very big time related to obesity. There is very seldom an endometrial cancer and the patient is not obese. Very seldom. The number one sign is postmenopausal bleeding. There is no screening. Just an endometrial biopsy. On the other side, between the two blocks, impact and depression, right stomach. Stomach cancer is related to no intrinsic factor, so B12 deficiency. So keep everything in those blocks because it's just short little spiels. So you're missing the intrinsic factor, which is the B12 deficiency, and you like it hot. So you like spicy, charred, hot foods. Spicy, charred, hot foods. You like your hot dogs black, your burgers black on the grill, your steak black, your catfish black, everything got to be burnt, well done, damn near burnt. So you just on some bullshit, okay? Because that charring that you like is charcoal, basically, carbon, right? So that's very bad for your stomach. But it's no big deal if you only do it on, July 4th or a holiday. This is a person that does this shit all the time. I got neighbors that cook out. They're retired. They cook out every damn day. And they like this shit black, okay? Hot, spicy, black charred food. Boom, stomach cancer. Nitrates, processed meat, smoked. You eat hot dogs, bacon, and sausage every day. Stomach cancer, okay? Go up a little bit higher, put cervical cancer because you have a lot more room for a whole lot of stuff. And it's not that much, but it's more than the others. Cervical cancer, you already know, is related to HPV. You know the vaccine is given to junior high schoolers. Before you're sexually active is the goal. Before you're sexually active. That's a prayer that you're not doing nothing in junior high, but you were kids. So cervical cancer. I told you postcoital bleeding is a symptom. Risk factor includes smoking, positive HPV, more than 3 children, because estrogen makes cervical cancer grow, more than 3 children, numerous partners, history of chlamydia, and birth control pills. Pap test, when do we start?
Or at 21.
21. Don't mess that up on a test because it's on there about that sexually active stuff. That's not true anymore.
No.
So it's at 21. It has nothing to do with it anymore. It's going to be at age 21. Remember why? Because every young person that is sexually active has already been exposed to HPV. It's everywhere. So since that person has already been exposed to HPV, we know that if you're a healthy young person, it will not cause cancer, but it does at 30. And so at 30, you get an HPV test. So you needed to know that PAPs start at 21, and you get them every 3 years. All the way through, at 30, you get an HPV test. If that HPV is negative, you go to every 5. Here's where everybody screws up. You think I said no pelvic exam. No, I said you don't need a Pap exam. If you're sexually active at 13, 15, 16, whatever, you need pelvic exams for all the STDs you probably have. But you don't need a Pap. 2 different things. Separate them in your mind or you'll screw your test up. So yeah, you need a pelvic exam, but you don't need a Pap because a Pap tests for cervical cancer. And you don't need a test for cervical cancer because at 16 it's not going to kill you. At 30 it might. So at 30 you need HPV testing. At 21 and every 3 years you need a Pap test. If any of them are abnormal, all bets are off. Throw that little routine out the window, right guys? So you go on a different program, okay, if anything's abnormal. Now, the diagnostic test is called a colposcopy. Don't get it confused with a colonoscopy. Here it is, colposcopy. Boom, done. Okay. We talked about testicular cancer already. Bladder and renal, I would want you to put actually the prostate. The prostate cancer, go forward, I guess. I don't know where it is. Holla if you hear me. Is it after? Oh, it's right after. It's right after what they call the prostate. Put renal and bladder on there. And all you have to know about renal and bladder cancer that is on the test is that it's based on smoking. It is caused by smoking. So on the prostatic specific antigen page, just put bladder and renal cancer is caused by smoking. Yeah, did you figure out cigarettes probably the way to go? Okay, so it's caused by smoking. And pancreatic cancer, it's caused by smoking, red meat, high-fat diet, and obesity. Smoking, red meat, high-fat diet, obesity. And genetics now, remember what we said, genetics? Okay, you should have a skin cancer page. We should say A, B, C, D after that. Yep, next one. On this page, we're going to put both skin and lungs since they're the #1 cancers. For skin cancer, it is what you read, A, B, C, D, E. So you're going to be fine, but you got to remember it like this. There are 3 types of skin cancer. Malignant melanoma is the one that will kill you. It's what killed my baby. Malignant melanoma is the one that killed my precious little girl that I told you about. That's the most deadliest. But there are 3 types, but this one is the deadliest. The lung cancer, which is what I want you to use this page for the most, lung cancer is usually terminal by the time it's diagnosed, because if you're in the early stages, you don't have symptoms. So stage 1 and 2 don't have symptoms. Once you have symptoms, it's already terminal. It used to be, we said, oh, well, you don't really want to treat it. I mean, you don't really have a lot of treatments for it. There's no screening for it, blah, blah, blah. But now there's screening for it. Screening for lung cancer has now meant cures for lung cancer. So if you have smoked for 30 pack years, now watch this, because I'm using weird language. 30 pack years is actually 1 pack a day for 30 years. Do you understand that?
Yeah.
Okay, now, but look at this. 30 pack years is also, get this, 2 packs a day for 15 years. Don't that make sense? Okay. So maybe you smoke 2 packs a day for 15 years, you qualify for screening. Maybe you smoked 1 pack a day for 30 years, you qualify for screening. Maybe you quit 15 years ago, so what? You still qualify for screening. If you quit 20 years ago, your insurance probably won't pay for it. So anybody that quit within the last 15 years and they followed this deal, and what's the age people start smoking at? 12. So that's a lot of people. That's a lot of people. Now, so if that's you, we do low dose CAT scans. Low dose CAT scans. CAT scans are a lot of radiation, but this is a low dose CAT scan every year, once a year, for 15 straight years. And now we can cure it because we're finding them earlier. Used to be no cure. Now, the type of lung cancer that this patient has is adenocarcinoma. That's the smoker's kind, right, guys? The one that has nothing to do with smoke is mesothelioma, and that is what my papa had. That's asbestos. He worked at Ford. They used to give guys checks if they would promise not to sue. $40,000 checks. My papa did not take it. Most of his friends did, and they're all dead. Worked there for 40 years. Quit the day my youngest was born because that was his first grandbaby. He quit in my delivery room. I'll never forget it. Okay, so mesothelioma. That is asbestos. Construction workers, Navy men, men in the Navy. Asbestos. Asbestos. So again, Navy, construction workers, plumbers, Ford, Chrysler, GM workers, roofers. Okay. The signs and symptoms of lung cancer: shortness of breath, coughing, hoarseness, clearing your throat, hemoptysis, that's coughing up blood, right, y'all? Now, the last 2 cancers that I want you to write on that page, because you already have a page on leukemia. These, laryngeal, pharyngeal, esophageal, just write those 3 body parts on that page somewhere. Larynx, pharynx, and esophagus. These are all related to HPV. Use your imagination to figure out how. So the face for this is Michael Douglas. And he was on David Letterman. He asked him, how the fuck did you get that shit? He said, oh, a whole lot of alcohol, a whole lot of smoking, a whole lot of going down. So there you go. Oral sex, smoking, and alcohol. Boom. Esophageal, more alcohol. Laryngeal, more cigarettes. But all 3 HPV. Remember how this goes. I just told you that cervical cancer was based on smoking and HPV too. So why do they have an affinity for each other? Because remember, HPV and smoking go together. So smoking lowers your immune system, so HPV can flourish. That's what you better know. Okay, there's no screening for those. Okay, go to the ANT page and just write leukemia, lymphoma, and multiple myeloma.